Hi guys, it's Nicole Jones from the Physio crew, and it's been an amazing week. I've been doing this locuming in Newbury and seen some amazing patients, seen some down in Barnstable as well. So I am in both clinics. Some people are saying, oh my god, have you left? Are you not in Barnstable? Are you not doing your Bristol clinic? I'm like, no, I'm doing it all to make sure that we are growing the business, and also so that I can have a lovely wedding, which is happening in July. So guys, yep, you can see all the online booking online. Just go to www.physiocrew.co.uk. Far right hand side of the menu bar is the online booking tool. Wanted to talk to you really quickly today about people with back pain. Had someone book in yesterday and then the GP told them, oh, you might have a slip disc, so don't come to physio, which is quite ridiculous because that poor man actually could have had some relief yesterday. So just to let you know, we treat people with, we don't call it slip disc, we call it disc protrusion, because that's the professional medical term to use, and actually the disc doesn't move out or in. That just doesn't happen. So it's a change of the shape in the disc that causes irritation to the nerves in the leg, and that can give you pins and needles and numbness. It's very often misdiagnosed anyway, so sometimes really nasty muscle spasm, which can be incredibly painful. That sometimes can be misdiagnosed as a disc protrusion. But I just wanted to say, guys, if physios are autonomous practitioners, so that means we can see people without seeing a doctor. We are trained to be able to ask those questions to make sure that it's nothing sinister in nature, to make sure that we're not missing anything like spinal infection, cancer. I'm sure it's not cancer, but we are trained to make sure that we can recognise those signs. We also are trained so that we can put you to the GP if you need to. So say for example you had a nerve root irritation that was affecting your hand and you were getting pins, needles and numbness, we would be able to do the testing to see whether how weak it is, there's progressive weakness, when we would refer you on, and then we just give you a letter with it all in, so you don't have to go to the GP and go, oh, the physio said this and I'm a bit confused. We literally just write it all out in medical terms, give it to them, and then they can then refer you on if it's appropriate. So I wanted to talk to you about back pain because it's something that affects lots and lots of people, and it's very debilitating, and no one should have to go through the fact that they can't put their socks on, or they can't play with their grandkids. Like that shouldn't happen. Back pain is very common, and in most cases it's sinister in nature is probably the right word for that. So non-specific lower back pain is going to affect 80% of the population. So that's the kind of back pain that comes and goes, pretty uncomfortable. Generally worse in the morning, but it doesn't affect going down to the legs, so you're not getting pins, needles or numbness. You're not getting pain that's going in the legs that's referred from the back, because some people don't realise that some of the leg pain that you get can actually just be that the nerve is impinged in the back. So if you imagine you had a hose pipe and you've got the water and it's flowing through really nicely, and then someone stands on that hose pipe or it gets kinked, that's the compression. So that's the nerve compression, which can be fluid can compress it. You can have a disc protrusion, which is a little bit of the disc changes shape slightly. People get very worried about disc protrusions. Don't be worried about them, because a lot of people have them with absolutely no pain. So at 31 years old, I have a 30% chance of having a disc protrusion, walking around, no pain whatsoever. And then I get a bit back pain when I get to 40, 50 or whatever age. I go and have an MRI. I then go, oh my god, I've got a disc protrusion. I may have had that disc protrusion the whole time. We only really care if it correlates. So if, for example, you were getting tingling and numbness in the distribution in the leg, which we know is correlated with the L4-5 nerve root, then we would say, right, okay, we might get an MRI if pain's not resolving. We know that most will resolve within a 3-month period. There are certain things that we would refer quickly for. So if you're getting progressive weakness, if you're getting pins and needles and numbness in both legs, if you're having any problems with your bowel or bladder control, so we would that would be an urgent referral on. So yeah, if you have any questions or anything like that about back pain, just give me a call, or you can message me on here. That would be fine. Remember, I'm in clinic quite a lot during the day, but I'll always call you back at the end of the day. If I'm finishing my clinic at 9, I'll probably just pop you an email, and then we can organise a time in the day for me to be able to give you a bit of advice. But if it's muscular, so if you're feeling it generally in the back and it's not going down the leg, there's two muscles that are really go into spasm, which tend to be your piriformis and then your QL. So your QL is on either side of the spine, and then your piriformis is in your bum. And the piriformis, a lot of people, the sciatic nerve runs through it. So sometimes that can present as sciatica, and sometimes, so sciatica is like an umbrella term, which basically means pain that comes from the back that's going down into the leg. And well, that's what the lay people will call it, is anything in the leg. But piriformis, technically I would probably put that into a slightly different category, but it can cause that symptoms, and that actually is really piriformis syndrome, which is where the piriformis is in spasm. That's giving the pain down the leg. That's quite easy to sort out. So what I would really urge that you do is, if you have back pain, keep moving as much as you can. You can consider applying heat, but it's different. So inflammation, if there is inflammation there, say you've got a facet joint irritation or a nerve root irritation, heat is going to increase the movement of the chemicals, because when you put energy into things, things move around quicker, and that can sometimes increase sensitivity, because we can feel pain from the chemicals, and that sends a signal up to the brain, and the brain decides whether it's dangerous or not, and then it tells you whether there's pain. And so sometimes heat can aggravate it, but if you put heat on and it relaxes it and it feels better, then you know that then that's gonna be helpful. So probably with heat, I would leave it off until you've spoken to a physio. Try and keep moving, so left and right, side flexions, pelvic tilts, knee to chest. Those can be really helpful to ease the symptoms as well. And then take some regular pain relief, as long as you haven't got any problems with any stomach ulcers, or you've been told that you're not allowed to take anything like paracetamol and ibuprofen because you're allergic to it, then regular pain relief can help as well. And I want you to be really strict with yourself, that when you're getting up and down from a chair, you're not holding on to things. If you anticipate and you tighten, that's going to make the pain worse. So try and make sure that you're doing your sit to stands. Try not to hold on to anything. Try and relax your body before you go up, and make sure you're activating your glutes. So make sure you're really squeezing your bottom muscle as you come from sit to stand. Anyway, guys, have a lovely day. I hope that's been helpful. So just a little bit on back pain for you. Take care. Bye bye.